All right, good morning, everyone, or good afternoon, I should say. Welcome to our second media panel from Navicent Health. Today, we are talking about infants, children, and COVID-19. So we appreciate you taking the time to come on and speak with us. This morning, or this afternoon, I keep getting confused, excuse me, the day is getting away. This afternoon, I do want to remind you of a few housekeeping items. We do have everyone's cameras turned off with the exception of our panelists. We do have everyone's microphone turned off with the exception of our panelists. Please submit any questions you may have through the Zoom chat feature. After our panelists present, then we will be taking those questions through the chat feature and presenting those to our speakers with us today. So let me go through and introduce everyone for you this morning. We've got Dr. Mitch Rodriguez. He's a neonatologist and the director of regional neonatology here in Central Georgia. He's also the business development director for Beverly and Olson Children's Hospital, Navicent Health. We have Dr. Patrice Walker. She's an OBGYN by training, and she is the Chief Medical Officer for the Medical Center, Navicent Health. And then we have Dr. Joanne Kennedy, who is a pediatrician and the director of our Hospitalist program at Beverly Knight Olson Children's Hospital. So thank you to our panelists for joining us this morning. Dr. Rodriguez, I'm going to ask you to kick us off, and then we'll go to Dr. Kennedy and Dr. Walker, and then we'll follow it up with that Q&A.
Great. Thank you. Good afternoon, everyone, and thank you for joining us today. Our goal today is to provide information that may assist parents as we go into this fall COVID-19 pandemic season and answer any questions that you may have. We will each say a few words of what we're seeing at Navicent Health and open the floor for questions. To begin, what I'd like to do is talk about COVID-19 and its impact on pediatric patients across the nation. And to do so, what I'd like to reference is a Children's Hospital Association article or summary that was just published last week. If you look at children, they represent 9.1% of all COVID cases nationally. Between 3.7 and 18% of all children that are tested were positive, and this was on a sample size of 9 states for this particular aspect. Children make up between 0.5 to 5.3% of all reported hospitalizations for COVID, and between 0.3 and 8.9% of all pediatric COVID-19 cases result in hospitalization. In those states that reported mortality, the mortality rate for COVID-19 in pediatric patients was 0 to 0.5%. If we look at Georgia specifically, out of this article, they also broke it down by state. The pediatric range that we use for Georgia is anywhere between 0 and 17 years of age. We've had a total of 16,427 cases in the pediatric population. Children represent 8.1% of all COVID cases in the state. We have seen in Georgia 263 pediatric hospitalizations statewide, and children in Georgia represent 1.3% of all COVID hospitalization statewide. As we continue to look at ways in which we can help our patients as during this COVID pandemic and testing, one of the things that we established at Navicent Health was a mobile testing unit. The purpose of this unit was basically help our parents and families that live in South and Southwest Georgia that need to come up for elective procedure. Part of our process for an elective procedure is that we want to make sure that the patient is COVID negative. Rather than having these families come up here for the test, go back home, and then come back for the procedure, our mobile testing unit is able to go to these families' home, obtain the test, get the results, and then the families only have to come up for one visit, and that is for the procedure, which has been a life-saving for a lot of these families because it clearly was talking about children that may have multiple complications and other problems in that respect. So when we look at COVID, what actually can we do to protect our children, ourselves, and our friends and other folks? The reality of the situation at this point in time, prevention is the key factor to everything that we do. And our school districts are working to ensure precautions are taken. What can we do as parents? Well, first of all, we need to be open. We need to talk to our children about COVID-19, discuss their concerns and fears that they may voice. And you have to remember, children have a great imagination. And if we don't answer their questions, if we don't engage with them in this conversation, they're going to fill in that void. And typically, children's narrative tends to be a little bit worse than what reality is. So I would seriously consider that conversations with kids is a vital component of what we need to do. The other component of what we need to do is model behavior. It's not do as I say, It's rather do as I do. So one of the things that we want to make sure is that we're modeling the proper behavior to our kids, that they see us going out to public, wearing our mask and doing social distancing, and doing the things that we need to do to protect ourselves. So just a couple of things that just kind of remind us of what we can do to prevent the spread of the virus. Wearing a mask, and not only wearing a mask, but wearing it properly. Make sure that your mouth and nose are covered. Practice social distancing, practicing good hand hygiene. For kids, remember to tell them not to eat food or drink after their friends, not to share school supplies, and to keep things out of their mouths like pencils, pens, etc. I would reiterate that prevention is the key to how we could minimize or reduce the infection of COVID-19. But as a hospital, the Beverly Knight Olson Children's Hospital is ready in the event that children become positive and symptomatic related to COVID-19. What I'd like to do now, Dr. Joanne Kennedy is the director of a hospice program at Beverly Knight Olson Children's Hospital and has had firsthand experience in caring for COVID-19 pediatric patients. I would like to have her share more details on how the virus impacts kids and on the child's body. Dr. Kennedy, if you please. Your microphone's on mute.
So sorry about that.
Okay.
So as Dr. Rodriguez has alluded to, we are so thankful and fortunate that the incidence of illness in children is much lower than it is in the adult population. However, it's not zero, and we have seen patients. We have even had patients admitted to the hospital. What I'd like to talk about are the signs and symptoms that parents should be watching out for. They are very similar to what we see in adults. So fever, fatigue, headache, sore throat, runny nose, and increasingly we're seeing that GI symptoms such as nausea, vomiting, and diarrhea are part of the COVID illness. Of course, this sounds very similar to many other viruses that children might come down with, including flu. So how do you know when it is or when it isn't COVID? If you're concerned, and certainly if your child has had a positive exposure, you would need to call your pediatrician. Really worrisome signs that you would need to go further and perhaps go to the emergency room or even call EMS would be if your child is difficult to arouse, if they're really struggling to breathe, so not just coughing, but really tugging when they need to breathe, or if you notice blueness around their lips, that would again be really worrisome emergency signs to come into the hospital for. I also want to mention something else we've been seeing related to COVID-19 infection in children, and that's called multi-inflammatory syndrome in children, or we call it MIS-C. And as the name alludes to, it's an inflammatory process. So organs in the body become severely inflamed. We think it's maybe an overreaction of the body's fighting off the infection. Every organ virtually in the body can be infected. So the brain can be affected, the heart can be affected, kidneys, really every organ in the body. But one of the signs is that the skin can be infected. So if you notice that your child has a rash, and another organ are the eyes, if they have red, irritated eyes along with fever, that would clearly be a reason for you to call your pediatrician. Because it may be the early signs of MIS or multi-inflammatory syndrome in children. We don't totally understand how this is related to COVID, but we do know that children who have presented with these symptoms and were tested have positive antibodies to COVID-19, which suggests that at some point in the past, they were infected with the virus. At this time, I think we'll go ahead and pass on to Dr. Patrice Walker.
Thank you, Dr. Kennedy. So I'd like to talk for just a few minutes about the expectant mothers and families. We have learned a lot about COVID and pregnancy over the past few months. And the good news is that COVID-19 does not appear to be transferred between the mother and the infant during pregnancy or during birth. We understand that it is spread through the respiratory droplets, which is why we have to wear masks and perform other aspects, including social distancing, but the method of delivery does not seem to affect or to have an effect on an infant's chances of contracting the virus. So regardless of whether our moms are having a vaginal delivery or a cesarean section, they're not at any increased risk just based off of that. Where we see transmission to infants is in those that are going to be in close proximity to someone who has the virus. And so this could include someone that lives in the home with the infant, or even someone that's visiting and holding the infant. I know that women generally have questions about whether or not it's safe for them to breastfeed the infant. Even if you're COVID-19 positive, it is safe to breastfeed the baby. What we recommend is that the mother would wear a mask, perform hand hygiene prior to, and of course afterwards. And, you really just have to do what is the right thing for you and your comfort level. If you would prefer to pump milk, you could pump milk and have someone else breastfeed the baby. But again, performing the proper hand hygiene surrounding doing that. But the benefits of breastfeeding, we believe, are multiple, because we know that infants get important immune factors through the breast milk, and one of those could protect them from getting COVID. So there is that advantage to consider. And finally, I'd like to talk about just the anxiety that many expectant mothers can feel in relation to COVID-19. Pregnancy in and of itself sometimes is an anxiety-provoking state, and putting that on top of being a part of a pandemic, many expectant mothers have to work. Many expectant mothers also have other children in the household with them. And so these things are all things that many of us have to deal with, but being pregnant on top of that can certainly be an additional stressor. And so all pregnant women should be having screening performed by their obstetricians. But even if not, I recommend having a conversation with your physician about any additional anxieties or stressors. We have various forms of treatment to offer, and we can always recommend social support services like any church or community group that may offer virtual support. And so I always want to bring that up as well. And finally, if you have concerns about exposure for an infant, signs and symptoms in an infant are going to be those that Dr. Kennedy explained prior. The infant is going to have similar, or in many cases, the infants can have very mild symptoms. And so as you're getting to know your newborn, you also want to understand what their sort of baseline energy level and eating patterns are. And if you see a change in those and have suspicion that your infant could have been exposed, then you'll want to bring the infant for evaluation with the pediatrician or with the emergency services. So that's just a brief overview. I'll turn it back over to Megan now, and we'll be happy to answer any questions.
All right, thank you all. We appreciate the information that you've provided so far this morning. I do want to remind all of our journalists that are here to submit your questions through the chat feature. Those questions will appear to be going to Kate Geyer, who is one of my coworkers who allowed me to use her corporate account this morning, but I am here monitoring those. So if you see them going to Kate, Kate is Megan today. All right, so for our panelists, we do have a question coming from the Baldwin County area. We've seen a number of those events that we normally count on in the fall be canceled. For example, the Georgia National Fair was canceled this morning, and a number of the high school athletic programs in the Lake County areas have decided to cancel their football seasons. We have a question from one of our journalists about whether or not this is the right move for those schools to make, and why canceling football and outdoor activity may be the move to make during COVID-19.
I'd be happy to take that question, Megan.
Thank you, Dr. Kennedy.
All right, so, just as we face the daunting task of figuring out how children should return to school, it also involves the after-school activities and events like the Georgia National Fair. The problem with these events is that there are large crowds of people, and you cannot be sure that everybody will social distance. You've all been hearing these things over and over again, and it sounds so simple, and yet everybody's sort of tired of hearing it. But social distancing, wearing your mask, hand hygiene, these are the things that are going to protect us from spread. And just as we saw here in the last few weeks of July and early August, we thought we had the virus under control, and things went up again as people came together. So, you know, each school is going to have to grapple with how they're going to handle it, and each parent is going to have to deal with, do they feel their child is safe? We wish that there was a book of instructions that said exactly how children should get back into activities, including school, but there isn't. So we need to do it on a local level. And I think parents really need to be sure that their school is being transparent with them, that they're talking with the parents about how they are approaching opening of school, what they will do if a teacher or a student becomes ill, what the plan will be if the numbers in the state of Georgia or in your particular county begin to go up again. The issue with sports is that even though people say, well, they're outdoors, so they're not in close quarters and sharing as much aerosolized germs, there's practices and there's huddles and there's, the kids are very close contact with one another. If people come to watch the games, it's going to be difficult to keep them socially distanced. So, I know we're all very sad. Believe me, I'm very sad about football, but this may be the right thing to do.
Thank you, Dr. Kennedy. And as a follow-up to that question, I believe this one would be a good one for you as well. We're seeing a lot of college students that are going to be going back to college classes. They may be moving into dorms. What steps should parents take if their young person, their teenager, is going off to college for the first time to make sure that they're being safe if they're living there in campus housing or going back into a college classroom?
Mm-hmm. So again, I think it's important to know specifically for your child, what are you dealing with? What are the sizes of the dorm rooms? How many people are living in the dorms? What have they done? Are they keeping every other room empty? In what way is the institution keeping things safe for your child to return to school? Was there another part to that question, Megan?
Yes, ma'am, that is it for that one. Dr. Walker,
Okay.
We do have a question for you. If a mother is expecting, what steps can she take in advance to protect herself from COVID and to ensure that she is protecting her child from COVID?
Right. I think there's not anything special that an expectant mother needs to do. It's the same thing that we're encouraging everyone to do, as far as, wearing the mask and wearing it properly, social distancing when possible, and hand hygiene. In preparation for delivery, having things on hand that that you'll need, so you'll minimize, having to go out and be in contact with large groups of people. So, getting all the diapers and any medication, and just preparing to perhaps limit, having to be out and about in those first, initial days or weeks. I'm not suggesting, not being able to interact with people, but, in those initial days, that would be an additional thing to consider. But other than that, I think, I don't want people to think there's something special that the pregnant patient has to do, or the pregnant woman has to do. It's the same thing across the board, those same things, and to encourage those in the family that are around her, or house people that live in her home, to do those same things, to make it a habit.
Okay, good. And a follow-up question to that, Dr. Walker, if someone is coming to the hospital to have their baby, what can they expect when they're coming in? Navicent Health hospitals are currently under a limited visitation policy. How can mothers prepare for that delivery?
Right, that's a great question. So right now, the current visitation policy is that an expectant mother can have 2 visitors or 2 support persons, and that could be a significant other, but it also could be something like a birth coach. However, they can only have one of those people with them at any one particular time. So 2 people total, but 1 person at a time. And even if a mother happens to be COVID positive, she can have 1 visitor. However, that 1 visitor must, of course, always wear a mask. And once they enter the room with the mother, they can't be in and out. They have to, enter and stay in. So we have accommodations for COVID positive patients as well as not patients. But we understand that, having a baby is a joyful time, and you want to have lots of family and friends around you. So we have to balance that with the just potential for exposure, whether you're inside the hospital or not. So limitations within the hospital, but I'd also ask the moms to think about how they can limit exposure once they get back home as well.
Thank you, Dr. Walker. For our panelists, we've got a great question from Joe at the Telegraph. I know my office has been trying to work around this, so I'm curious to hear the answer here. And I would ask this to all 3 of you because you each bring different perspectives. But Joe says that we have mentioned the importance of modeling behaviors. What can be done to break down any barriers to get parents to see the importance of wearing a mask themselves and modeling that behavior for their children? Dr. Rodriguez, you want to start us off with that one?
I will. I think that's an interesting question, because you get into the root of individuals' behavior and how they approach this problem. And the easy aspect of that question is essentially show someone the effects of what this disease can cause, not only to an adult but pediatric patient, and they could see the results on their own, but that's kind of gruesome to do so. So what we're left with is essentially trying to talk with individuals and get them to understand the significance of not so much what it has an impact on me, but the impact that it has downstream, i.e. meaning if you don't wear a mask and you do contract COVID-19, well, guess what? You may be in your 30s or 40s and you may be relatively asymptomatic and not have any problems. But if by default you live or come in contact with someone that may be at higher risk because of comorbidities or because of age, that disease process for that individual will be quite different in that respect. So it's a hard question to answer, because you're really trying to grapple with individuals' beliefs in that respect. But I think it's just a matter of trying to educate as much as possible. Joanne?
And I think, for children, it's always how the adults around them are modeling the behavior. So I think it's very important that, of course, that we all wear a mask, but especially in front of your children, you're talking about it. And when you wash your hands, that you're talking about how long you should wash your hands for. Sing the ABC song so that you know that you've been washing your hands long enough. And of course, the teenagers, and getting back to the kids going to college, that can be a little bit more tricky. But again, if you're modeling the right behavior and talking to them about it, that may help. For the younger kids, there are some videos that the American Academy of Pediatrics has on their website, aap.org, for parents to talk to their children. And for the older kids, I think that if you look at some of the YouTube videos that show the transmission of particles with a mask on and without a mask on, that visual can perhaps have an impact and get even young adults and children to wear their mask.
Thank you. Dr. Walker, go ahead. Did you have anything to add?
Sure. I try to make comparisons that I feel like, are similar to other things that we do in society. I have an 8-year-old, so we talk about safety, issues, and I have put the mask in the category of wearing a seatbelt. We brush our teeth, and so I try to compare it to other things that we do that we all just know that this is the right thing to do, and link that to, your seatbelt is for safety if you get in a car accident. We don't know if that's going to happen every time we get in the car. We get in the car, we go somewhere, and most times we get there safely. So wearing a seatbelt doesn't seem like a big deal until you get into that accident. And, the same thing with brushing teeth. Nobody wants to go to the dentist and have cavities. So I try to link it to other similar preventative measures that are already a part of society.
Thank you, Dr. Walker. Dr. Kennedy, we have a question about parents who are wanting to bring their children to Beverly and Olson Children's Hospital, maybe for emergencies that are not related to COVID. What can parents expect if they're coming in for something that is non-COVID related, but their child still needs to come in for treatment?
So they can access our emergency room just like they always do. If there were COVID patients in the emergency room, or even what we would call a PUI, a person under concern, they would be kept separately, and they're in rooms that are protected for them and for the other children around them. So it should not affect your ability to come to the ER at all. Do not be nervous about being exposed. We practice infection control always, and especially during this COVID pandemic. And we do have, a specific pediatric emergency room. So you're not there with adults who are also being seen. It's just children, and it's just pediatricians seeing the children.
Thank you. All right, so our panelists, we've got just about 2 minutes left here. I don't see any other questions coming in through the chat feature. If you have any questions, please go ahead and send them in now. To our panelists, is there anything we haven't covered that you would like to add or like to let our local media know?
I would like to encourage everybody to remember about influenza this fall, and that in addition to COVID-19, we may face an outbreak of influenza, but luckily we do have vaccines available. So please, everyone, encourage your readers and your family to please get the influenza vaccine.
I'll strongly reiterate what Dr. Kennedy just spoke of. I think that we have to be mindful that the influenza will be coming in this season, and we do have a vaccine, and it creates a situation where if you don't have the vaccine, we're not sure if we're dealing with just a common cold, if we're dealing with the flu, or we're dealing with COVID-19. So we could take part of that equation out of the picture by vaccinating, and we need to be prompt on doing so.
Absolutely. The flu vaccine is recommended and encouraged during pregnancy as well. So I recommend that as well.
All right, well, thank you all. I don't see any other questions coming from our journalists. Guys, if you think of anything later, we're always here and happy to answer those questions. To our panelists, Dr. Rodriguez, Dr. Walker, Dr. Kennedy, thank you for taking time to join us this afternoon. I hope you all have a great day and stay safe. Have a great day.
Thank you.
Thank you.
Thank you.